Good evening, everyone. My name is Gian Torrijos. I'm 38 years old. I live here in Rockwall, Texas. I am happily married to my wife, Jennifer, and we have a 3-year-old daughter named Amelia, and also one more baby coming up soon in the next few months. I'm a nurse for 15 years. I started my nursing career in home health and worked in adult, geriatric, and telemetry nursing in Parkland. Then eventually moved to work in chronic and acute dialysis settings. And currently, I am now a nurse for Texas Health Resources in Dallas, formerly Presbyterian Dallas, in the cardiovascular ICU unit or surgical ICU unit. I came here in 2004 after finishing my nursing degree, and I started my first ever job. I work in a warehouse and fix furnitures to pay for my NCLEX. And finally, in 2006, I passed my NCLEX. I started working for the home health and the hospital. Then in 2007, I joined the military as a Navy corpsman, and eventually I deployed with the U.S. Marines in Helmand Province, Afghanistan. After my deployment, I came back here in the U.S., in Texas, in my home state, then went back and started working again as a nurse, and eventually took my Master's of Science in Nursing with University of Phoenix, and I finished it in 2019. When did I found out that I wanted to be a psychiatric mental health nurse practitioner? In 2009, when I had the opportunity to deploy with my Marines in Helmand Province, Afghanistan, I had this opportunity to take care of this young girl that was brought to me by her father because she was having a fever for several days now. Um, what I did was I utilized medication that was common to them and was familiar, very familiar to me because we use it commonly also in the Philippines where I grew up. It was called paracetamol. I was able to obtain this medication during one of our patrols, one of our missions prior to the incident, and I was able to give that medication to the family and especially to the young girl. And eventually, after a few days, the parent and the patient came to us, and they were so happy that the fever already subsided. So the father was so grateful. Another incident was when I had the opportunity to stitch a young kid's hand when he got it caught up in a farming equipment, and his father brought him to me, and I was able to stitch it up. Another incident was when um, two Afghani young boys were trying to stab each other, and I had to stitch one of them in the head and the other one in the belly. Um, and these incidents made me wanted to be um, more wanted to be made me wanted to be more of a nurse practitioner. But why psychiatric mental health nurse practitioner? One reason was because of the feeling that you give when you become a nurse practitioner, when you take care of people. You give them this satisfaction, you're able to give them hope, especially when you're able to heal them in their stressful situation. Another reason is when I was taking my master's of science in nursing education, um, I was listening to NPR news trying to get some ideas for my papers, and one of the conversations that I heard in the radio was that there was a big lack of psychiatric mental health healthcare in the United States, And the biggest problem was a lot of patients would, especially those who are coming from the rural areas were having a hard time coming to the city and obtaining um, health management. By the time that they get to the city, they are already in severe distress or in really big need of care. So I wanted to be more available to our community in caring for their mental health, especially veterans that are in need of mental health care, those who have PTSD. How would I see myself in 5 years? In 5 years after I finish my post MSN certificate in psychiatric health, mental health nurse practitioner program, I would be working in the military and I would provide psychiatric mental health care to veterans and patients with PTSD. And also, I will be more accessible in the rural areas in our community here in Texas. Um, this is my goal in the next years in the future. I hope you give me this chance to be a part of this wonderful discipline, nursing discipline, and I hope to be one of your students. God bless. Thank you so much for listening to my story.